Introducing Oncotype DX to your practice is really very easy. They have data now from TAILOR-X, they have data from several other prospective retrospective studies that can help guide them as to whether they should recommend or not chemotherapy to their patients. It's an easy decision also for the patient. And then once we get the results, we look at the data, we can give them numbers and tell them that this is what the chance is for the chemotherapy to benefit them or not. And then they can make that decision very easily. With the TAILOR-X data, we have a difference in how we interpret the results based on the age of the patient. So what I do is I really help TAILOR-X guide me. I look at the data that they have, and based on the chance of the chemotherapy benefiting these patients, I have that specific discussion with the patient.
There are several other genomic assays. We really don't have the same level of trust in those, so that's not what we use at our practice currently. It's going to be less expensive in the long run to test and omit chemotherapy from a large number of patients because the cost of administering chemotherapy and dealing with the resulting comorbidities from that is pretty significant. It's definitely, in the long run, a cost savings measure.
I would tell somebody who's incorporating the Oncotype score into their practice now that they're making a great decision, that they are helping their patients out by identifying those patients that don't need chemotherapy and identifying those patients who might benefit from chemotherapy the most. So you're really doing your patients a good service and allowing them to also understand the biology that's being driven from their cancer growth.